Let's do a neurology case. This is completely made up. I made it up. This is not a patient I've taken care of or any of my colleagues have taken care of. If there are similarities, it's likely coincidental, and it sounds similar, or if it sounds similar, it's likely because these cases are very common. Okay, let's say we have a 30-year-old lady, this lady who has jerking of her right upper extremity. She also has some twitching of her right face. These events are brief, they occur infrequently. They last for a couple of seconds. That's how brief they are, and she's fully conscious during these events. Originally thought they were stress related twitches, but since then they've gotten a little more frequent, so now she's concerned. No other family history of seizures. She doesn't have any other past medical history. She lives by herself in Brooklyn, doesn't drink, doesn't smoke. She has an MRI done. Her MRI is completely normal. Her EEG does show left frontal spikes. So this lady has focal epilepsy. She retains awareness during this episode, so they're focal aware seizures. And because she has motor movements, it's focal aware motor seizures. To classify, we use this chart right here. So this is focal onset seizure. She has retained awareness and it's motor. It is unfortunately cut off in this picture, but that red area is your primary motor cortex. In front of it, you have your supplementary motor cortex, and even before it a little bit, which is also cut off, is your premotor cortex. This is all part of your frontal lobe. It controls movement. So if she is having twitching of the right side of her face and arm, likely her left motor cortex in the frontal lobe is involved, which is why the EEG would show spikes in the left frontal region. So one caveat, usually these types of seizures don't always show up on EEG. You can have retained awareness, brief seizures, and the EEG can be normal. It only shows up 20% of the time. So in that case, if you are able to find abnormalities on EEG, definitely you can treat. You can treat with any of the focal seizure medications. However, if there's no concrete evidence, sometimes we treat anyway to see if there's resolution of the symptoms and to see if the patient gets better. And if they do, then you've proved that it is epilepsy. Anyway, I hope that was helpful. I plan to do a few more of these. I do think they could be fun and interesting, not just for patients, but other learners that do watch my TikToks. Thanks.